Today, we have the great honor of presenting the Tara Cook Award for Innovation in Neuropalliative Education. This award is named for its first recipient, Tara Cook, a treasured colleague, friend, and founding member of our neuropalliative community, who died earlier this year from colon cancer. Tara's husband, Kenneth Cook, is accepting the award on her behalf today.
This award recognizes and encourages early career individuals who have demonstrated a commitment to neuropalliative education with special emphasis on educational scholarship, scholarship and innovation that bridges neurology and palliative care, enhances skills of practitioners in both fields, and advances the educational mission of neuropalliative care.
Tara was one of the earliest neuropalliative community members that Neha and I ever met. At a time when neuropalliative care was only just coming into its own as a field, Tara was already enthusiastically sharing her plans for spreading the neuropalliative gospel via educational initiatives. Her professional drive was inspiring, but what was most memorable from those early meetings was her kindness and genuine interest in the people around her.
Since those first chance encounters, Tara became an extremely active community member whose reach was felt across professional societies. She was amongst the first at the American Academy of Neurology to present interactive communication workshops. Her teaching style was focused on providing practical techniques that would improve the day-to-day practice of clinicians, and even skilled neuropalliative providers left her talks having learned something new. A visionary in the realm of neuropalliative education, Tara developed innovative teaching techniques at her own institution, adapting models first developed in the general palliative care world to neurology resident education.
It is now our privilege to introduce Dr. Bob Arnold, Tara's colleague, to share some words about her.
So I'm going to read what I wrote because I'm not sure that I can do it without water in my face. They're probably not words to express how happy I am that the International Neuropalliative Care Society has developed an award in Tara Cook's honor and asked her husband to receive its initial presentation. I could tell you a lot about Tara, about how she became a neurologist at the University of Iowa, how she worked in the armed services, traveled the world, and loved Alaska, Kent, and biking, although not necessarily in that order. I could then tell you about how she came to the University of Pittsburgh to complete a palliative care fellowship and joined our faculty. I could tell you about what an amazing teacher she was and how she won our first palliative care teaching award. I could tell you how she reached out and began to integrate palliative care into neurology, teaching the first communication course for neurology residents that's ever been developed. NeuroTalk is now taught to both first and third year residents, and the new chief of neurology asked if we could teach it to all their new faculty. I could tell you about the weekly calls she got from neurologists asking her for palliative care advice, or the time she taught me how to treat migraines in a patient with pulmonary hypertension on prostacyclines, something that I now know how to do. But I'm not going to do that. Instead, I want to tell you what she taught all of us at the University of Pittsburgh about living fully and dying with dignity, about how she showed us how to find meaning, not in big talks, but in spending time with patients and helping them and their family, and how she held on to that meaning of life with both hands. I'm going to tell you about the degree to which she became part of our families and will live with us the rest of our careers. So many of my faculty want to do work in palliative neurology to honor her memory that they sort of fight to do the teaching. I wish you could have been at some of the celebrations that she allowed us to have and the degree to which she walked with us through her illness and taught us what it was like to live with the life-limiting illness. She was a special doctor, neurologist, palliative care doctor, but most of all, she was a special person, and I'm thrilled that you've developed this award in her honor.
Thank you so much for that beautiful remembrance, Bob. We are honored to have the opportunity to honor Tara's legacy in neuropalliative education and know that future awardees will carry on her spirit of service to the neuropalliative community.
Turning now to Tara's husband, Ken. We thank you for being here today to accept this award on Tara's behalf and for sharing her with us all these years. It is with deep gratitude that we present to you the Tara Cook Award for Innovation in Neuropalliative Education.
Thank you. Tara would be so excited and also so humbled by this recognition. From early on in her career, she knew she enjoyed teaching and passing on her knowledge to the next generation. She loved being a neurologist, but knew that there was a more personal way to practice medicine, and neuropalliative care was that niche. I could always tell when Tara had a learner with her in the hospital or when she was teaching communication classes at work. She would come home so excited that she was able to pass on her knowledge to those who were eager to learn. I truly appreciate the INPCS naming this award for Tara in recognition of her professionalism and commitment to education. And would like to thank you for asking me to accept this in her honor. Thank you.
Thank you, Ken. And thank you, Bob. And thank you to the INPCS for making this award possible.